pronounced Theos.
Theos. Denise Theos. Thank you.
Hello. I'm a resident of Windsor, a mother of two, and a practicing registered nurse. I want to speak against the fluoridation of our water supply. This practice is extremely outdated and actually originated in the 1940s to prevent tooth decay. Today is 2012. The dental profession has changed, it has evolved, it has been researched, and the end result is a superior understanding to oral health. I'm a nurse. My question relates to fluoridation and the ethics regarding providing this to a mass population. Simply, on the internet, we can search to find a simple definition of medicine. We can all go to Wikipedia. It means a drug, also referred to as a medicine, a medication, or medicament. It can be loosely defined as any chemical substance intended for the use in the medical diagnosis, cure, treatment, or prevention of disease. Let me repeat. To cure, prevent, and treat a disease. This would make one wonder and feel that fluoride is a drug. It certainly fits into the definition. This chemical is used primarily to prevent and treat tooth decay. It is therefore an understanding that it is a medicine and has been acknowledged as this by many countries in our world. As a nurse, I can administer medications or drugs, but there are strict guidelines to follow regarding dosage and orders from a physician. I cannot medicate anyone without an order from a physician and the patient's consent. And that patient also has the right to ask questions, to ask if that medication is safe for them. What will it do? What will the side effects be? If the patient refuses, I can only document. I cannot force this medication. The patient has a right to refuse. Fluoride cannot be forced on the population. I guess I'm a patient. Do you have consent? Do you have a prescription signed by a physician or a group of physicians willing to take on the liabilities of a whole population? This is unethical mass dosing of a population without consent and knowledge. How many toxicologists have actually researched our Windsor supply? Have you actually informed Windsor County residents of what is in their supply? Some of the dental profession now recognize that topical fluoride works just as well for dental issues and is well documented in research. No longer can we consider it a systemic benefit, but we can look at it as a topical treatment. Fluoride can therefore be a choice to those who would like to have this. The ingestion of fluoride has little benefit but many risks. I will just name a couple. Dementia. This is one of our largest issues, not only in our own city, but in the country, in the world. This costs healthcare millions of dollars each year. The National Research Council found that fluoride damages the brain, and IQ is also affected. Bone. According to many medical communities, fluoride diminishes bone strength and increases fractures. Both animal and human studies from Harvard have found a connection between fluoride and bone health. In fact, osteosarcoma in males below 25 years old are at risk and will die from diagnosis within a few years. Thyroid. Fluoride reduces the function of this gland, and this leads to weight gain and a loss of mental acuity. In conclusion, adding fluoride to our water is illegal. It is a drug forced on a mass population to treat an issue that can be treated in a more advanced society. We can treat tooth decay and those at risk through the dentist by topical treatments or in purchasing inexpensive toothpaste, etc. Where will this end? I hope here. Just in the last closing, as a mother, I have always discouraged my children from drinking juice and pop and all those things. I have always told my children that water is the healthiest source. Now, I do not think so. Thank you.